by LAURAN, NEERGAARD and STOBBEU. Health authorities again expanded the nation's booster campaign Thursday, opening extra doses of Pfizer's COVID-19 vaccine to several million 16 and 17-year-olds. The EU and many other nations already were urging adults to get booster shots to pump up immunity that can wane months after vaccination, calls that intensified with the discovery of the worrisome new Omicron variant. On Thursday, the Food and Drug Administration gave emergency authorization for 16 and 17-year-olds to get a third dose of the vaccine made by Pfizer and its partner BioNTech, once they're 6 months past their last dose. And hours later, the Centers for Disease Control and Prevention lifted the last barrier as Dr. Rochelle Walensky, the agency's director, issued a statement strongly encouraging those teens to get their booster as soon as it's time. Boosters are important considering that protection against infection wanes over time and we're facing a variant that has the potential to require more immunity to be protected, Walensky told the Associated Press. About 200 million Americans are fully vaccinated, including about 4.7 million 16 and 17-year-olds, many of whom got their first shots in the spring and would be eligible for a booster. Vaccination and getting a booster when eligible, along with other preventive measures like masking and avoiding large crowds and poorly ventilated spaces, remain our most effective. The Pfizer vaccine is the only option in the EU for anyone younger than 18, either for initial vaccination or for use as a booster. It's not yet clear if or when teens younger than 16 might need a third Pfizer dose. But Walensky said the CDC and FDA would closely watch data on 12 to 15-year-olds because if they eventually need boosters, we again will want to act swiftly. Vaccinations for children as young as 5 just began last month, using special low-dose Pfizer shots. By this week, about 5 million 5 to 11-year-olds had gotten a first dose. The extra-contagious Delta variant is causing nearly all COVID-19 infections in the U.S. and in much of the world. It's not yet clear how vaccines will hold up against the new and markedly different Omicron mutant. But there's strong evidence that boosters offer a jump in protection against Delta-caused infections, currently the biggest threat. The booster vaccination increases the level of immunity and dramatically improves protection against COVID-19 in all age groups studied so far, BioNTech CEO Ugur Sahin. Complicating the decision to extend boosters to 16 and 17-year-olds is that the Pfizer shot, and a similar vaccine made by Moderna, have been linked to a rare side effect called myocarditis. It's a type of heart inflammation seen mostly in younger men and teen boys. The FDA said rising COVID-19 cases in the